All right, so thank you for joining us today for part 2 of Information and Data Privacy. As we get started here, I'd like to recap what we did during the first week. So we discussed what data privacy is, the importance of data privacy, principles that affect data privacy, culture of organization that's related to data privacy, the importance of staff training, and we discussed some aspects of security, and we ended with a discussion on data minimization. Today, Ashanafi will continue to discuss strategies for data minimization. I'll go over quickly privacy laws, and then Jen will cover transparency in data collection and consent. Ashanafi will be covering topics related to data inventory and mapping and access to information. And the broad picture, all these items that are listed here are within the principles that we discussed last week, namely minimization, individual participation. This relates to consent, to use and sharing of information, accountability. Organizations are accountable to protect information, and purpose specification and use limitation. This relates to information where the specific purpose for the data collection is included in consent, and how data is stored, how data is used, and how long it will be stored for. And data transparency, meaning that organizations will communicate how the data is used, maintained, stored. And there will always be the element of security in all our discussion on data privacy. Learning objectives or outcomes for today will apply. We hope that at the end of the session, you'll be able to apply data minimization strategies in your work, apply data transparency principle in data collection, be able to conduct data inventory and mapping of the data in your organization, and to be able to identify who in the organization will have access to sensitive data or personal identifiable information. So I'll start out by providing a very brief introduction to the current US laws, and Jen will be including a link in the chat so that you can access a PDF that provides more details. So here are some US laws related to data privacy, and the ones that are very familiar to people will most probably be the US Privacy Act of 1974, HIPAA, and FERPA. So in that document, it describes very briefly what each of those laws relate to. So I would encourage all organizations, knowing the data that you're working with, the data that you collect, be aware of the laws that would apply to the data that you collect, use, store, and share, so that all activities are compliant with the laws. And there are state laws. This map shows across continental US the status of US state privacy laws. And the green states are the ones where there are laws signed. And the one that's referenced most is the California Consumer Privacy Act. Washington State does not have a signed law, but it also has other regulations in place, such as My Health, My Data Act. And Ashanafi will be speaking about this throughout when he talks about inventory and mapping and access. And then, for example, there's a biometric privacy, and there's a student user privacy in education rights regulation. So now I'll invite Ashanafi to continue speaking about practical strategies for data minimization.
Okay, thank you. So last week we talking about data privacy, and one of the ways to maintain data privacy and remain compliant to privacy laws were data minimization. And we define data minimization as the idea that we should only collect what is truly necessary to serve our mission. So the principle we said last week was easy, that's collect less to protect more. And we believe that every unnecessary data field creates a potential risk. So today we will look at the practical strategies for applying data minimization in your daily operations. So the first strategy to collect minimal data is to question every data point. What we should do is, before creating any form or intake tools, it is worth to pause and ask, do we really need this piece of information? Is it essential for our service delivery? Is it essential for compliance or reporting? So for example, I will later show you a slide, the change made by the food bank. So for example, a food bank really only needs a name, or zip code, or and a household size to meet reporting needs, and collecting social security numbers unless required creates unnecessary risk and other informations, right? So we need to ask whether we need that specific information for service or compliance or reporting. If we don't need that one, if the answer is no for all these questions, then we don't need to collect it. The second strategy is, unless it is required by the vendor, we need to use broader categories. For example, instead of asking a full zip address, a full address of an individual or participant, then we can use a zip code instead. Or age, for example, is a required demographic variable. Then there are different ways of collecting age, for example. If it is not required by the vendor, we don't need to collect date of birth, because date of birth is personally identifiable information that can be traced back to individuals, and we don't need to collect that one unless it is required. So we can collect age in other alternatives as well. Again, if we can ask the specific age of an individual or the birth year, if that is required, but still there are other safer methods. For example, we can, if for organizations that work with adolescents from 10 to 24 years of age, we can ask a specific category. This is a specific example from WHO. I am not saying you should follow this, but this could be an example. If you work with adolescents, we can collect their age as 10 to 14, 15 to 17, and 18 to 24. In this way, we are protecting some kind of privacy. Even if it is leaked, it will be really difficult to trace, to identify an individual or a participant from here. So the first one is to question each data point. The second is to use broader categories, and the third one is to handle sensitive data with extra care. If it is absolutely necessary to collect sensitive data, we should document why we need it, explain to participants how it benefits them, and then consider alternatives like self-attestation. For example, for King County's offices now, they use self-attestation than immigration information, right? So if there is an alternative to use self-attestation, it's better to use than collecting very sensitive information. Otherwise, if we have to collect it, if it's required by offenders, then we need to document it why, and we need to explain why it is important to collect that for our clients as well. So the third one is to handle sensitive data carefully. And the fourth is to conduct regular review. So at least annually, we should review our intake forms and make a field assessment. Each field should be assessed and remove unnecessary data fields if there is any, and update them in response to changing privacy laws. So many King County organizations did this after the new law passed in 2023, and it's possible to do this one. So if we are able to question every data point, then use a broader categories and handle sensitive data carefully, and then conduct a regular system review, we will be able to kind of maintain a minimal data and ensure privacy. So last week we had a breakout discussion and did not have time to debrief and share each group's experience. Please go ahead and share in the chat if your group used different strategies from those discussed above. And we will, if we have time, we will summarize it in the end, or otherwise we will summarize them for the next session. So there are strong local examples. The Food Lifeline reduced intake requirements to the bare minimum, for example, and King County programs replaced immigration status collection with self-attestation. And these are very critical examples. I will focus on the Food Lifeline example. So this slide shows a great real-world example of data minimization in action. The Emergency Food Assistance Program, which is by Washington State Department of Agriculture, has streamlined its household intake process to collect only what is absolutely necessary. As you can see on this form, clients now self-declare. This only collects two pieces of information, name and household size. So the federal USAID guidance requires only those fields plus address if applicable, but Washington State has gone even further. Well, their website shows an update in October 2025. The address field and the signature line have been removed and reducing unnecessary personal data collections. So this update reflects a shift towards privacy respecting design, balancing compliance with federal standards while protecting client dignity and minimizing risk for community food programs. So it is a simple, powerful example of how minimizing data can still fully meet program requirements. So here is the document from the Washington State Department of Agriculture that highlights how state-level policy reinforces community concern and data minimization in practice. Okay, so that means all household information, including income, is self-declared, and clients should never be asked to provide proof of dignity, proof of identity, address, and citizenship. This removes unnecessary barriers, protects personal privacy while still ensuring accountability for service delivery. So this approach reflects how data minimization can be implemented system-wide while still meeting program requirements. However, even if we are promoting for data minimization, we don't want you to take a wrong idea that there are certain things that we should collect, right? It's important to recognize that some information forms the essential minimum. So the baseline categories every program should collect to ensure consistency, comparability, and inclusion across the county. For example, the core demographic data represents the smallest set of data needed to meet vendor and reporting requirements while respecting privacy principles. So even though we emphasize collecting less, there is certain piece of information every one of you, every organization still needs, and that are the core demographic data. So these are the core demographic variables or data that we are all required to collect. Even if we are required to collect, we can still apply the principle of data minimization on how we are going to collect them. For example, earlier I said that age is the vendor or by the program. We don't need to collect date of birth. We can collect age in a kind of category or in a range value. Besides the core demographics, there are others recommended or optional fields that can help your organization understand clients' need in a more holistic way. And these are some of them, some of the recommended variables. They are not mandatory, they are not required, but they are kind of recommended. And they are highly sensitive. They might require a careful deliberation if you decide to collect them. So now let's bring it all together by looking at how data minimization and privacy work hand in hand to protect the people we serve and strengthen organizational integrity. Fewer data points mean fewer risk points, reduce exposure if there is a breach, and stronger compliance. This in turn enhances community trust. People are more willing. So now, for community organizations in Washington or elsewhere, what it means is the message is collect only what is essential. If you must collect sensitive data, including core demographic and other recommended essential information, you should handle it carefully. Be transparent about what you are collecting and minimize risk whenever possible. And remember, a strong data privacy starts with data minimization. If you don't collect it, you don't have to protect it. So if you don't need it, every field is risky and don't collect it. So that's all about data minimization. And next up is Jens.
Just a quick interjection here. Thank you, Ashinafi, for all the ideas and strategies on data minimization. Before we invite Jen to come on, are there any pressing questions that need to be clarified before we move on? Thank you. If there is nothing pressing and a question pops up, please enter into the chat and then we'll address it at the end. Thank you. Jen, please.
Thank you. I also just put that we are noticing some small stalls in the video and audio, so we appreciate your patience. And there will also be the recording to review afterwards. But if you're really having trouble, please message me in the chat. So next, we're going to talk a little bit about transparency and with regard to consent when we're collecting data. Next slide. Thanks. When dealing with data privacy, it's really important for us to remember the difference between confidentiality and anonymity, right? As these two are related concepts that are often confused. Confidentiality means that when a person discloses private information, they can expect that we're not going to share it, right, with others without their permission. You and each member of your data collection team need to understand what steps and processes your organization follows to assure that participants' or clients' data is not shared without their permission with those who don't have a legitimate need to know. On the other hand, anonymity means that the data researchers collect contains no information that could be used to identify or trace a specific participant or client. So while anonymity provides the lowest level of risk of a data breach, it's often not feasible, right? When absolutely no direct identifiers are collected from participants, you may be able to assure anonymity. An example of this might be an online survey in which no names or other demographic data was collected and the participants' IP addresses were not tracked. When you're conducting focus groups or listening sessions, anonymity can never happen, okay? So I know this is an area where lots of people use to collect information, and we don't want to accidentally promise anonymity in a focus session when really what we mean is confidentiality, right? In a focus session group or listening session, the participants are sitting with each other and they're hearing what each person is contributing to the discussion. So in focus groups, the best practice is to ask the participants for confidentiality, but confidentiality also cannot be guaranteed since we can't promise that other participants will abide by it even if we request it. Next slide. Obtaining consent when collecting private information or data is a key piece of operating ethically with the data that an organization handles. Specifically, obtaining consent shows our respect for persons and their personal autonomy. That is, what we need to give consideration to in terms of the person's opinions and choices. In order to do this properly, the participant or client needs to receive information and consent to their data being collected before they participate or engage in disclosure. Next slide. You can advance the left-hand part if you wouldn't mind. Thank you. Okay. Sorry, got stuck. There are several best practices for obtaining consent in data collection. Now, as I just mentioned, you cannot use any information from the participant or client that was obtained prior to the consent process. So this means, like, if you're sitting around chatting with a client and they mention some key information about why it's hard to make their appointments on time, and you know that your colleagues are conducting a study on barriers to keeping appointments, you cannot share the information from the client with your colleagues because the client did not know that what they were disclosing could be used in that way. Participation in sharing personal data always needs to be voluntary. So that means that we need to be careful not to coerce individuals into sharing their data by making, for instance, large incentives which could unduly sway their decision, or by implying that their engagement with other organizational services could be affected by their choice to consent or not consent. When walking a person through a consent process, the information they need to make an informed decision needs to be presented in an understandable and meaningful way. This means it needs to be at a grade school reading level and in plain language. There are lots of resources online, and I'm sure organizations have their own for checking the grade reading level and finding plain language for commonly used terms. Consent forms or processes should always include certain information. Go ahead and advance the right side of the slide. Here's the information to include, right? The purpose of the project, what the person who is consenting can reasonably expect the risks or discomforts will be, right? So maybe you will feel uncomfortable because we're talking about a time a doctor's appointment didn't go well, right? The expected duration of their participation, whether this is particularly if there's a study or something extra beyond your usual services that you're asking clients to consent to. Also, they need to know their reasonably expected benefits of participation. However, these should not be overstated. In most cases, for instance, when we're collecting data for research purposes, there's not a whole lot of individual benefit that a person gets. There might be benefit to society or benefit to the group, right, that person shares characteristics with as a result of the research, but we need to state that clearly. And finally, the consent form needs to outline the procedures that are going to be followed during the process or the service or the engagement that the participant or client is having with your organization. Next slide. It's important to have a little bit of information about consent on data use. And you might wonder, how is this different from what we've just been discussing? Well, it's sort of a continuation. One key thing to remember is that consent is a process, not a one-time event. So if someone comes into your organization, they sign a consent form, you might think, check, that's done, right? But in fact, consent needs to be revisited on a regular basis, and we need to make sure that if we're suddenly going to use a person's data that in a way that we didn't ordinarily say, then we need to make sure that we're asking for consent again. So at the bottom of this slide, you see that there are a couple of example scenarios where you might have to ask for additional consent to use data. For instance, if, again, I said the data is used in a new way that was not explained in the initial consent process, if the data is going to be used in a way that now will expose the client or participant to additional risks, for instance, now we're putting some information online, or if in the course of the project or service, data about others who did not consent to that product or project or service is collected, then we need to circle back with those people. Next slide. Let's see, is that it? I think that's it. Yes. Thanks. Back to you, Ashnafi.
Yeah, thank you. So from this section onwards, we will introduce core building blocks for data governance, including data inventory and mapping. So before we can protect data, or we were talking about or presenting about data privacy and data security and protection. But before we can protect data, ensure compliance, or making decisions with confidence, we first have to know what data we have, where it lives or where we store it, and how it moves within organization. And that's where those two processes come in. That's data inventory and data mapping. Together with those two, data inventory and mapping, they are steps that create a clear foundation for privacy, efficiency, and accountability. So in the next few slides, I will try to break those concepts down and show how organizations can apply them in practical ways. So before that, okay, sorry. So previously, I could see that I had a poor internet connection. So that must be why it was interrupted. So let me know if it happens so that I can repeat what I said. So we asked you all what kind of information or data do you collect and store. So most participants reported to collect and store program-related data, demographic data, followed by service, evaluation, and financial and donor personal client data. So this suggests that most data managed are programmatic than individually identifiable. And we also asked where are those information or data stored, and nearly all responded that you store the data you collect in cloud or web-based system, such as Google Drive or Microsoft Drive, and while smaller numbers use laptops, computer hard drives, and web database, there are still a few who still rely on thumb drives and other storage methods. This shows again or indicates a variable practices in data storage and potential difference in data security and standards. And we also asked who do you currently share your information or data with, and most of you responded that you share your data with vendors and staff, followed by consultants and donors. Fewer organizations share their information with committee members and program participants or program partners, suggesting that there are different data sharing practices and primarily focus on funding and internal operational context. So this shows what type of data you have, where you store your data, and with whom you share. These are inputs for data inventory and mapping. And now, what's data inventory and mapping? So we will see. We'll try to use those concepts. Okay. So data inventory is a process of cataloging or listing out all data your organization has. In other terms, when we talk about data inventory, we are simply referring to knowing what type of data do you have, or what type of data your organization has, or where does it live, or where do you store your data, and how it is used within the organization. So think of it like an organized file cabinet, but for all your digital and physical information or data. For organizations, this means identifying things like client records, staff information, financial data, or program outcomes, and understanding how each is managed. Having a good data inventory gives you a clear picture of your organization's information landscape, and it helps you know what is valuable and what is outdated and what needs to be protected or what needs protection. It is also a key step in ensuring compliance with vendors and state privacy laws, and it lays the groundwork for responsible data and informed decision in your programs. So there are key components of data inventory. In order to apply data inventory, we need to go through those steps. And a good data inventory has 6 components that help an organization clearly understand its data landscape. And the first one is data identification, data classification, data location, data ownership, usage, and data security and compliance. So a comprehensive data inventory lays the foundation for strong governance, risk management, and compliance. Together, all those 6 components strengthens trust, compliance, and data-driven decision-making. And we will see each component one by one in the next slides. So the first key component of data inventory is data identification. This data identification is really the first step in building a solid data inventory. It's about knowing or recognizing and documenting exactly what type of data your organization collects and works with. For most organizations, it could mean like client data, financial data, staff recording, or program data. This is what you responded and what I shared earlier. So pretty much these are the type of data that you are required to list out or catalog in order to do the first step of data inventory. So this process helps you understand the full range of data your organization holds, not just for a compliance purpose, but also for improving service delivery and decision making. Once you recognize and document those categories, it becomes much easier to manage those responsibly, ensure privacy, and avoid losing track of important information. So think of this as a foundation for all data management practice that follows. Everything that we are going to talk after this will based on this data identification. So the second component is data classification. So once you identify your data, the next step is classifying the data. And in other terms, what we need to organize or sort out our data by type, sensitivity, and importance. For example, when we say sensitivity, we mean how confidential is the information. For example, personally identifiable or protected health information can be highly sensitive, while internal planning documents or performance reports that shouldn't be shared publicly could be medium sensitivity, and others could be low sensitivity, right? So, or we need to classify our data based on importance. That's how critical the data is to your organization's operation. For example, financial and compliance records needed for audits and or vendors could be regarded as highly important, but temporary notes or outdated drafts could be considered as low importance. So this classification helps you know what needs tighter control, who should access it, and how long should you keep it. Or this will help you to build a culture of responsible data stewardship. So the next step, the third is data location. So after classifying your data, the next step is to understand where the data actually lives. It can be within the organization, like a computer or laptop or hard disk, or it can be in the cloud storage or third-party system. So knowing where every data set resides helps maintain visibility and control. You will know who can access it, how to protect it, and how to recover it if something goes wrong. This helps build the bridge between data organization and data security. The fourth is data ownership. Data ownership means assigning responsibility to someone in the organization who can take care of different types of data. So there is always someone accountable for maintaining and safeguarding each data set. In essence, data ownership is about accountability and stewardship and making sure every data set has someone responsible for it. So this accountability and stewardship together, they both ensure that your organization will have someone who is responsible to take care of each data type. So the fifth type is data usage. Data usage is about understanding how your organization's data moves, who touches it or uses it, and why it is being used. First, look at the data flow. Then how information travels from intake form or survey to reports or dashboards and other vendor submissions. Next is to review user access, identify who interacts with the data, who uses it, and who have access with a particular data type. And finally, define the purpose, why you collect and use each data set, whether it is to improve service or track outcomes or meeting grant requirements. Being intentional about data use ensures transparency and ethical practices. When organizations understand how data is used, they can make informed decisions, they can reduce errors, and strengthen community trust. So this is important. This actually is what data mapping is. We will talk about data mapping. When we talk about data mapping, we are practically talking about data usage. Okay, so the last component of data inventory is data security and compliance. So this is to ensure that all information your organization handles is properly protected and aligned with legal requirements. So following those standards isn't just about meeting legal requirements, it's about maintaining the trust of your clients, staff, and partners. So strong security and compliance practices show that your organization takes privacy and data protection seriously. Together, all of those 6 steps or components strengthen trust, compliance, and data-driven decision making. Okay, so now we will have a breakout session. And in your breakout room, we will review 2 of those 10 data points or variables on the right. And for each, please discuss and agree on data type. Try to categorize or to at least classify it based on type. You can give it your own category, or you can use client, staff, financial, program, or operational. And then try also to classify them based on sensitivity level. You can use public, internal, confidential, or restricted, or you can use high sensitivity, medium, or low sensitivity. And then please try to indicate potential risk if misused or breached. And you will have 5 minutes, and please be ready to share 1 to 2 key insights when you return. Thank you.
For folks to finish coming back.
Clara, good to see you.
Okay, another 15 seconds or so, and everyone should be back. Okay. Welcome back, everyone. I'm going to turn it over to Ashinafi.
Okay, welcome back. Okay, so I hope you had a nice, productive discussion. So who would like to share what they discussed and decide? Okay. Shall we make it volunteer, or shall I just call the room number?
Well, I don't remember what room number I was in, but
Okay.
I can speak for our group. I think it was 7. Let's see, we kind of talked about, let me look back at the stuff. So we kind of started from the bottom, and we were talking about like data collected under federal grants or contracts, and how varied that can kind of be depending on the type of organization and the report out requirements. You know, how we still want to maintain that privacy and that can be held. However, in the instance of like an investigation of any sort, like that might then include, but that would include people that are also held to the same standards as us if they're conducting an investigation. I'm not sure what all to report out about, but like I think that was kind of a rich discussion about like, you know, like trying to maintain client privacy as much as possible, but also like assisting with investigations or with like the quarterly reports or how often you're doing reporting.
Okay. Thank you. So did you consider this federal grant or contracts as a highly sensitive or low sensitive or something like that?
Well, yeah, that was one of the other things we talked about is like certain information, depending on who your funders are, it has to be public. But that's like data that has had like it's statistical data that is numbers not attached to individual people. And so for instance, I used to work in housing, permanent supportive housing, and we had to report out like certain information like accidents that have occurred or different things like that in a public space. I don't remember all the things exactly, but they were just kind of like more of like incident reporting kind of like numbers.
Okay, yeah.
And referral numbers. But yeah, so some of it would be public. Some of it would be restricted information that we're providing to the funders. And then some of the information was also restricted from them unless it's in the case of like an investigation.
Yeah, thanks for sharing. Yeah. Okay, thank you. Who else can share? We will give a chance for one group who would like to take the opportunity.
We had more of a discussion around considerations around collecting data, which was really nice to hear about different orgs. I think two of the things that came up are just like for intake forms and even just establishing a relationship with clients if you're working with clients that are under a lot of surveillance, like proving who you are and the organization that you work for before asking for sensitive data, because people can be really reticent to volunteer that information, obviously, and want to make sure there's lots of checks in place to make sure you are who you say you are and you're not an ICE agent or something. And then another one I was thinking about is like my organization, the identified client or patient is actually the parent. And so even though we're funded through Best Starts for Kids, we actually don't collect any information about the children because they're not our clients and we don't need that information. So I've been thinking a lot about, what purpose that serves for us. And I think historically it's served the purpose of like not tracking whether or not people are carrying pregnancies to term as being sensitive data. But obviously this conversation is making me think more about just in general why having children's data when we don't actually need it might be a better practice, which is what we're already doing. But
Okay. Yeah, thanks for sharing. I think that's really valuable, right? If this presentation makes you think that there are certain data that you don't need, I think that's what was the intention of it. Okay, thank you. So I think if you have, I have the next slide. This slide contains the 10 variables and many others, and I tried to kind of identify and categorize the data based on the type, sensitivity, and importance. So for example, if you see the first one, the intake form, case notes, and demographics, for sensitivity, I categorize them as high sensitive data because they contain personal or identifiable information. And for importance, I thought these are critical or highly important because they are required for service delivery and compliance. And for category or type, I categorize them as personal or service data. So this categorization, you can categorize in a different way that makes sense to your organization. But for me, I tried to create a hypothetical organization, and I tried to categorize this for this one. And again, the categorization may vary based on, for some, for example, for personal identifiable information, it should be highly sensitive for everyone. But for some of the categorization, it could change based on organization to organization, based on its importance and meaning, however it gives meaning. So we will give you this slide, and you can refer it, but you shouldn't really strictly follow if you don't feel it necessary. Okay. So now I will try to say what does data inventory mean, or why does it matter for organizations? So it matters for organizations because it improves data awareness. It prevents duplication and loss if we categorize them, if we identify them, if we know their places and how to use them, and if we assign ownership. That means we will prevent the duplication and loss. This supports risk management and enhances reporting accuracy and promotes accountability. So for this purpose, if there is any way that we can accomplish this whole thing, then that means it really matters, right? So because that's what we are supposed to do in order to be compliant with the laws and maintain privacy. So the next is what is data mapping, right? So while data inventory is about cataloging or listing out data, data mapping is about creating a roadmap of how data flows through an organization. That this process maps out the data journey from its origin, like it can be from the source of the data to its until it dies, right? So we have to map out the data journey from its origin to its various destinations and uses within the organization. It's like drawing a detailed map that shows where data is stored and how it transforms along its life cycle within the company. So here, the right side is example data mapping structure or template, but you don't necessarily adhere to it. I will show you an example, for example, which has a different structure than this one. But this is one organization provides this as a template for data mapping structure. So data mapping has again 5 steps. That includes data identifying data source, and this identification data source means what are the data sources that we have for our organization. Like it could be intake forms, partner database, or financial systems. Once you know where the data source comes from, you look at your data collection methods. How are they being collected? Is it collected manually, or is it entered or imported? Whether it was collected whether it was entered manually, or whether it was imported from online other sources, or did we use an automatic sync system? Then once we know or define our data source, then we need to map out the data flow. This traces how information travels from one place to another place, such as from a staff computer to a shared drive or cloud system. Then comes transformation and utilization. This means we need to know where are the data being cleaned, analyzed, and turned into reports or dashboards, or where are they used to inform decisions. Finally, it is essential to ensure compliance by making sure every step aligns with privacy and security laws like HIPAA and the Washington Privacy Act or FERPA. These processes help organizations protect sensitive data and improve efficiency across their programs. So these are very important 5 steps, and let's see them when they are actually applied to an organization. So I created an ideal or hypothetical organization, and I tried to create data mapping for that organization. Okay, so as you can see here on the left here, you see the data sources, information coming from different systems such as CRM, or that's customer relationship management, database, survey, and websites. And after that, you can see that my data collection methods are manual entry, imports, and other sources. Then after I tried to show the relationship between data source and the collection methods, and then finally where the data is repository or deposited or stored. And this could be any kind of database or any kind of cloud. It can be Microsoft, for example, or Drive, or it can be shared drive, or it can be any Apricot or any other things that you are using. So you can include any kind of data source, data storage that you use here. And from there, there are different users. It can be staff. You need to assign who is accessing. That's the potential users or analyzer or administrator. So can access and use the data responsibly. Some information is also shared with partners. As you can see, you can show who is using the data. So like vendors, or to meet reporting or compliance requirements. And finally, when data is no longer needed, it moves to archive or secure disposal, ensuring sensitive information isn't kept longer than necessary. So throughout the entire process, though, as you can see it here, okay, the organization must ensure compliance with laws like HIPAA, FERPA, or Washington Privacy Act as well. So this is an ideal example for data mapping. So if you know each source, like if you know your data source, data collection methods, data storage, user, partners, then you can substitute those sources, and you can create your own organization's data mapping. So why data mapping matters for organizations? So it matters because it enhances data security, it improves program efficiency, it supports compliance and accountability, it builds community trust, and informs better decision making. So mapping your data isn't just a technical exercise, it is a strategic pathway to build stronger programs, safer communities, and sustainable impact. So while a data inventory focuses on what and where of a data mapping explores the how and why. And this reveals how information is processed, transferred, and used throughout the organization. So the inventory serves as a foundation. They are interrelated, and the inventory usually serves as a foundation, giving a clear picture of what data exists, where it resides, and who is responsible for that. But data mapping builds on that foundation by showing how this data flows, transforms, and interacts across systems, teams, and processes. Think of one website says, think of this as a library. Data inventory is a catalog that lists every book, and its location, while data mapping tracks each book's journey, like from checking out to return, capturing who accessed it, how it was used, and together, both practices, that's data inventory and mapping, those practices provide a complete and dynamic understanding of your organization's data landscape, and they help to strengthen privacy, efficiency, and accountability. So there are proposed checklists to implement data inventory and mapping in your organization. And let's see, these are the best practices for effective data inventory checklists, and there are 4 activities. So when we here the process begins with comprehensive audit to stock out all of the data your organization collects, whether digital or physical. Now, usually because we are living in a digital world, some organizations may collect data on paper or questionnaire. So we need to remember that those are also part of our data. So that means looking at spreadsheets, databases, paper forms, or even notes from staff. Next will be to organize and store data in a safe and easy to find place. In other terms, we need to use data archiving tools or systems that can help us categorize and store your data safely, and make retrieval simple when needed. Okay, it is also important to assign data stewards or choose someone to be the data point person, and specific staffs who will maintain and update the inventory regularly. Having a data point person ensures accountability and consistency. Finally, we need to establish policy. We need to create rules for managing data, for how new data is added, how outdated data is removed, and how privacy and compliance are maintained. Together, okay, these steps, if we apply those 4 steps, we can create what we call a living inventory, one that stays accurate, accessible, and aligned with your organization's mission and privacy standards. So to implement data inventory, we need to start with comprehensive audit, then organize and store data in a safe and easy to find place, choose someone to be a data point person, and create a simple rule for managing data. So to implement data mapping, we have, again, 3 important steps to do. The first is to define clear objectives, to making sure that the mapping objective is in line with our organization's mission, vision, and priorities. The next is to map data flows visually. So when we say data mapping, we are talking about visual presentations. And for this case, we can use diagrams, flowcharts, or even simple mapping tool to show how data moves between systems. For example, from client intake forms to reporting dashboards. Visual maps make it easier for staff and partners to understand how data is used and where vulnerabilities are or might exist. So finally, we have to regularly review and update our maps, right? So once we develop a map today, it doesn't mean it will remain the same forever. So we need to regularly review and update our maps. If we regularly review and update our maps, then we will keep it functional and useful. So once we know what data we have and who is responsible for it, the next step is controlling who can access it, right? So for data mapping and inventory, we were talking about where our data is and what data we have, how is it transported, why is it transported. Now, we are going to talk about who is going to access it. Okay, this slide focuses on limiting access and managing permission and making sure people only see the information they truly need to do their work. This section explores the concept of the need to know and least privilege principles and the key distinction between the 2 approaches. So when we say limiting access, we mean minimizing authorized access, which is one of the most effective ways to protect the sensitive information we collect from clients, staff, and partners. The goal here is simple. Make sure that only people who truly need access to certain information can do so. So unauthorized access isn't always intentional, and we need to prevent people, or even if they are staff members, they shouldn't have access to information they don't need it for their daily operation. So it can happen when too many people have broad permission or when accounts aren't reviewed regularly, but even small oversights can lead to data breaches, loss of trust, and compliance violations. That's why it's important to apply there are principles. There are two principles for to limit access or minimize unauthorized access, and they are need to know and least privilege. And we have best practices as well, role-based access control and regular access reviews. So in the next slides, we will see those principles and best practices to limit access or minimize unauthorized access. So access control is a fundamental part of data security. It's what keeps sensitive information safe and ensure only the right people can see and handle it. And there are two principles that guide this process. So the first one is the need to know principle. This principle grants access strictly based on necessity. So meaning staff only gets the information they need to perform their specific jobs or duties. For instance, a program assistant might need to see client contact information, but not financial or health data, right? So they don't use it, or they don't benefit from using accessing financial or health data, so they shouldn't access it. But for a finance or accountant, financial information or payroll or financial information is important, but health data is not helpful, so it shouldn't be accessible for them. This focused approach ensures sensitivity data isn't unnecessarily exposed and reduces the chance of breaches or misuse. So the second principle is least privilege principle. So under this principle, every staff member receives the minimum level of access necessary to perform their duties, no more or less. And this doesn't just control what information they can see, as we saw earlier. Need to know was about necessary information access, but this least privilege is limited or is about what can they do with the information. So we need to limit people, what can they do with the information? So can they delete? Can they transform? Can they share the data with other people? So we need to give permission based on what is required for a specific task, right? For example, a data clerk might be allowed to input new client data, but not delete or export entire data set, right? If we limit them from deleting or exporting entire data set, then then we are trying to prevent or we are maintaining privacy and preventing potential breach as well. So this restriction is vital because it helps prevent both mistakes and intentional misuses. Even if someone's account is compromised, the damage is limited because they have only limited access, and that damage will be limited to that kind of data access. So when combined, the need to know and the least privilege principles create a layered defense, so ensuring that the right people have the right access and nothing more. This approach minimizes risk and strengthens overall data security. So the two principles are need to know and least privilege. Now we'll see the best practice for limiting access. So the best practices are the role-based access control. Role-based access control means instead of giving permission by name or preference or acquaintance or closeness, you assign access based on someone's role. For example, a finance staff member might access payroll records, but not client case files, while marketing team members can see campaign data, but not financial information. This keeps access clean and minimize misuse. Next is to conduct regular access review. So every few months, check who still needs access, especially as staff or volunteers or contractors change. Some organizations they keep. Some individuals can have access even years after they leave the organization, and it shouldn't happen, right? Another is, you are probably all familiar with multi-factor authentication, right? When you verify your identity, when you log in into your email or secure systems, this adds a crucial extra layer of abstraction. So avoid shared password or open shared drives. These are common weak points. Instead, keep permission specific and documented and up to date. Okay, the key takeaway here is access control is not one and done. It's an ongoing habit of review, adjustment, and accountability. So these are the best practices to use role-based access control, regular access review, and multi-factor authentication, and document and monitor changes over time. So why restricting access to sensitive information matters? So restricting access helps us to protect organizational data. It ensures compliance and builds trust and accountability. So restricting access isn't just an IT task, it is shared responsibility that strengthens your organization's overall data security posture. So to wrap up, implementing both the need to know and least privilege principle creates a strong layered approach to data security. And these two principles complement each other, and need to know ensures self-access only the information necessary for their role, while least privilege limits how much they can do with the information. Together, they reduce opportunity for error, misuse, and breaches. So the key message here is limiting access throughout thoughtfully not only safeguards information, but also reinforces accountability and integrity across the organization. So, and to summarize what we what we saw earlier, or what we covered so far, if we are able to do an exhaustive data inventory and mapping, and accompanied it with limited access to it, applied need to know and least privilege principles, and use role-based access control and regular access review, then we will be able to build a strong data privacy framework. I hope this helps, and this is what I have put it.
Thank you. Thank you so much, Ashnafi, for such a comprehensive overview of the content and the slides that you have provided. So I'm going to share now, and while I'm going to share a slide, but anyone, as you're thinking about questions, please feel free to either put it into chat or raise your hand, and we'll be happy to address the questions. And I have just shown this slide that has a link to our evaluation form. We welcome your feedback and how we can improve our training sessions. And please either scan the QR code, or Jen has included the link in the chat. You may click on the link and provide us the feedback. Someone had asked about Spanish support, and we are more than happy to meet with you one-on-one if you need support in Spanish language. So please reach out to us at ask.dicentra, ASK Dicentra, and we'll be happy to connect with you to provide that support in Spanish. And for anyone who has questions and would like to follow up with us, please send us an email also. And if you're an organization that is receiving funding through BSK, you may also request capacity building support on data privacy and other matters using the link. Let's see, I'll move to the next slide here. Using this Airtable link that sends the request to Stefan at BSK, and he'll connect with you to understand what the data capacity or capacity building needs are, and connect you with a consultant that way. And the support from the consultant is free to you and your organization. All right. Any